Yeah, a couple of questions for Dr. Tam. We're about to hit 100,000 cases. Canada is 12th on the list in the world for number of deaths, 17th in the list for number of deaths per 1 million population, which suggests that things haven't gone brilliantly. So first question, if you had to give a report card to all the efforts done in this country so far to tackle this, what would your report card be?
So I think as we come down the sort of side of this first wave, it is good time to take stock of lessons learned and how we've done. I think Canadians have done an amazing job in all of their efforts to practice physical distancing, staying at home when they were asked to do so, and trying to learn all of these new hygienic measures and keep up with it. So we need to have a sustained path forward so that these become actual everyday practice, so that that can be sustained, because we know that this, we have learned more about how this virus is spread. I think that in Canada, of course, one of the biggest lessons learned is about who is most severely affected in the vulnerable populations. And in particular, I think our first wave of epidemic really impacted seniors and those who live in seniors' residences or long-term care facilities. So that's got to be the biggest lessons learned for Canada, and where much has began, but more needs to be done to ensure that that doesn't occur, and that best practices are in place, infection control, but also the conditions of living and congregate living, and how we treat our seniors in general in society. And that is a responsibility for governments, but also for all those who manage long-term care homes, and also society writ large. The other aspect of, I think, where spread has occurred more rapidly and accelerated in other vulnerable settings. So we've got to learn from those work settings, for example, which include more crowded spaces, but congregate living spaces for workers, workers who are not paid well enough and they have to transfer between facilities. All of those things is what has, I think, driven some of the bigger clusters and outbreaks in Canada. And we need to have learned from them. And so as we move forwards, that the surges in cases doesn't happen again, because we've learned all of those things, which I think some of the other countries have learned as well. So particularly some of the other European countries who may have some similar setup in terms of the elder care, and also some of these workplace phenomena. So I think what we have done is, with everybody's help, flatten to the curve to the extent that we did not overwhelm our acute care system, but we certainly did not do well in the sort of long-term care senior setting.
And secondly, looking at the challenges ahead, you mentioned concern that some young people are being complacent about mask wearing. I'm thinking of what you've mentioned about old care homes, horrifying spike in cases in some US states. Looking ahead, what are the main challenges to you as you and your colleagues continue trying to handle this? And how do you quantify the seriousness? Are these hiccups that can be dealt with fairly easily, or is there the potential for one or more of these challenges to really knock you off course?
So we continue to learn about this virus, and I think the fact that we've learned about how this virus could spread in a hidden way, people with very mild symptoms or sometimes no symptoms at all, which could be the case in younger populations, is that people will forget as we, the number of cases come down, and which is great. But I think it's the sustainability of our response going forward that is going to be really tough. So we will just have to keep reminding people, maybe use behavioral science and visual cues as to, well, how do you keep that physical distancing? You've seen in parks where people draw circles, or people have lines on the ground to remind people how to keep physical distancing, because it's not easy to sustain that kind of approach in people's minds. But it's really, really important, because the virus hasn't disappeared. We have probably low immunity in the population. We are still going to be doing those serological testing to see what the prevalence is in the population. But the virus has not gone away. There's a misconception. I think I got asked the question last week, which was, well, has the virus changed? Is it less severe or less transmissible? Well, no. The cases are coming down because of the public health measures that we've done, not because the virus itself has changed. It's the number of cases reduced because of all of those things that we have put in place. So I think together with the chief medical officers, we're trying to think, well, what are the sustainable measures that we can keep going, while at the same time, the key is to build up enough public health capacity and healthcare capacity to essentially clamp down, detect and clamp down on any cases and contacts. So some of our collective readiness measures to reduce resurgence is related, as everybody has heard, increasing laboratory testing capacity, increasing contact tracing abilities, and making sure people have a safe and appropriate place to quarantine and isolate. And so you will see those measures continually to be built up, and we are certainly one of the scenarios we're preparing for is a potential surge in cases come the sort of fall and winter season, and plan that ahead, and also plan for a scenario, for example, where influenza might be circulating at the same time. So I think what we're asking all Canadians to remind themselves is it's not normal times. We're not going back to before January 2020, and that everyone, including young persons, must follow local public health advice.
Thank you, Dr. Tam. Mr. Aiken.
Thanks. All right, David Aiken.